All right. Well, it's the first segments. Now, I did get some good segments for
Is this the one you saved for me, or is the next one the one you saved?
This is the one I saved for you.
Okay.
Because this one's pretty interesting. Brittany, you're going to like this one, too.
All right, okay. Get ready.
So this first segment is one of those segments where I see it and I'm like, is that really happening? Because it's almost unbelievable. And this may be actually one of the unintended effects of kind of the change in the body. So Kalee, we talked in the past about like what's the desirable body type per social media, per celebrities. And historically it was always the Kardashian body, and in the past year or two it's gotten more toward the slim ballet body. Things change. And this may be one of those unintended effects of that. So this is a segment about rib removal surgery. Is this a new trend that is happening? And it actually comes from an article from the New York Post. And so I think the New York Post is pretty good, but sometimes they'll be a little clickbaity. So I definitely wanted, and I did take a picture of that. Throw that up, Brent, if anyone wants to see that article. Yeah. And there was a little bit more to it. So this came up in the New York Post and is about a 24-year-old, an American named Emily James, who is documenting her surgery journey on TikTok. Now, I want to get your opinion on this, Kalee. I oftentimes see big-time news articles written about someone's social media posts. Is that weird to you? Because to me, it's a little odd that like suddenly a big news outlet is going to put something out there based on someone's TikTok.
Well, if you would have asked me like 3 or 4 years ago, I would have been like, that's crazy, but not anymore.
Yeah, it's pretty commonplace. It still kind of blows my mind, though, that it's like, okay, New York Post is not, I don't know, the Wall Street Journal or New York Times or whatever, but, they are pretty legitimate.
Every news organization wants to be the first one or the one that gets the click or like whatever, or the story. And so I'm not saying that they're not, I'm just saying that. Take that with a grain of salt.
I know where you're coming from. So, Emily James, 24-year-old, documented her surgery journal where she had 6 of her ribs removed for cosmetic purposes.
Aren't our ribs there for a reason?
Yes, they are, and we are going to talk about that. Now, I will tell you guys that this is not a brand new thing. It also has another name called the ant, like the insect, the ant waist surgery. And I've heard about this more as like a novelty, like when they used to drill holes in people's heads, and you're like, oh, that used to be a thing. So like
on Grey's Anatomy.
Yeah, well, I meant like with like the rocks, like the trepanine.
Okay.
Yeah,
Okay, got it.
I was thinking of it as like, oh, this is something they used to do back in the 50s that suddenly is not done anymore. So when this article popped up, I was like, really? So I went and looked at it, and at first I was shocked that they did 6 ribs because the normal surgery is usually 11 to 12 because those are the floating ribs. I think I got a pic. Okay, why don't you guys look at this?
I'm so glad. I was about to take my jacket off and like feel where my ribs
feel
were.
where your ribs are. So
crazy.
Historically, rib removal is 11 and 12, which are the ones that are called floating ribs. They're not attached to your sternum or your breastbone. The 10th does kind of attach to some the cartilage a little bit further back, and normally that one's not always taken, but I did actually dig into this girl's social media. I went through her TikTok. She did have 10, 11, 12 removed, again, for cosmetic surgery. And before I kind of dive into like, okay, what are the results of this? Is this
I have so many questions.
Oh, good. I'm ready. I would. All right, well, get ready. I'm going to say one thing, and then you guys jump into your questions. I was like really interested whether or not she had this in the United States because I don't know how to say this. I just couldn't see a legitimate plastic surgeon in the United States doing 6 rib removal for cosmetics. And so I spent a lot of time going through this girl's many posts on social media, and I did eventually find her say, I'm not going to release the name of my surgeon. I don't want to like attract a bunch of attention. However, I am convinced that she did this out of the country because, and this is crazy, they gave her ribs in a plastic bag to take home with her.
Oh, 100%. Yeah, it's got to be in a different country.
There's no way that happened.
So yes, 100%.
All right, now you guys got questions. You want to jump in now or you want to keep going? Okay.
I did have a breast reduction when I was younger.
Okay,
so
totally.
I did
I do
have
those all
my
day.
leftover in a jar to take home with me to sell on eBay because I was like, I know somebody will spend lots of money on this.
I have done 1,000 breast reductions in my career, like literally. I've never once in my life had somebody ask to take. So
I've always been an entrepreneur.
So they were like, They were like negative Ghost Rider.
Yeah, they said no. They said no. So that is my number one, that this did not happen in the United States.
Yeah. In fact, I was going to bring a picture, but I was afraid like YouTube might censor it because she literally has a photo.
I wish you did.
I wanted to, but you never know with social media, like if they'll flag it as
like a bag of ribs?
It was a bag of ribs. And it looked like legit human ribs to me, who I know what those look like. Okay. They look pretty legitimate. But then I was afraid, well, I don't want to do this awesome segment.
But what is she going to do with those? Oh, sorry, I'm going to get way off the beaten path.
I have no earthly clue what she may or may not do. Maybe she'll make jewelry out of them?
That is so gross.
It is kind of gross, but I have no idea. She didn't really.
Is there like bone marrow in them?
Oh.
Yeah, like in the center for sure.
Oh.
What would she do with the bone marrow, I wonder?
Can't you like get paid for that? Yeah. I'm always thinking.
I don't know, but there's a picture of her on her social media holding a bag.
Can I see it off screen?
Yeah, I'll send it to you. Yeah, I will send it to you. Because I actually clipped it and I was like, do I put that in the episode? Or because it was like very clear that these are ribs and it had like, a little bit of tissue on them. And I was like, oh, I don't want to like have my video get struck down.
Kaylee's first episode get flagged.
I know, I don't want your. I know, right? So I erred on the side of caution. This would be like, for our like, if we had the thing where you're like a subscriber or whatever, like, okay, come to the subscriber, we'll show you the ribs.
We'll show you the ribs.
So.
Okay, so I have to ask you this. What do 10, 11, and 12 do? I'm very interested in that.
Well, and that kind of cuts to the chase of, one of the things that I'm going to say, because, No, it's fine. I mean, these ribs protect your vital organs. When you think about what do these ribs cover? Well, there are two very important organs that are quite fragile that are underneath them. On your left side, your spleen. And if you've ever known anybody that's been in a car wreck, you might have heard them say, yeah, I ruptured my spleen. I mean, that's a life-threatening problem. Your liver on the other side, which is even more dangerous to rupture. It's a little bit more solid than the spleen, so the spleen is more vulnerable to blunt trauma like car crashes. I mean, when I was a general surgeon doing trauma, I took out so many spleens. I mean, I don't remember how many, but but now this girl does not have ribs covering her spleen. If she's like in a car crash,
the seatbelt.
Yeah, I mean, it could be that.
But the seatbelt's down here.
Yeah, probably I wouldn't be too worried about that. It's more like taking something like that, like if somebody came, into you, or if you weren't wearing a seatbelt, you hit the steering wheel, or you hit the side of the car. Okay. Like, I mean, she's legitimately in danger of receiving a more serious injury that causes, internal injuries.
It's literally protection that she just voluntarily removes.
Yeah, she's just like, you know what? I don't need those ribs. Like, I'm fine. So, I do want to like touch base on the results, because I like to look at everything very objectively, right? I'm going to cut to the chase that I think this is a super terrible idea. I would never recommend anyone do this ever. So I just want to get that out there for you guys. So please don't rush out to get your, and I would never do the surgery, but let's be fair. Let's talk about results. She did go from a 32 to a 24-inch waist, allegedly. And I do have some pics. I have like a series of 3 up there, Brittany. Yeah. So sorry, she did this sideways and I just kind of threw it in there. So the one on the left is her before. You can see on the right, clearly, there is a much more kind of hourglass type figure underneath her rib cage. So her rib cage is there on the right, obviously, or maybe not obvious. And there's definitely that indentation or that hourglass ant waist look because her ribs are gone. Now, the one on the far right with her in the corset, I mean...
Yeah, I have a hot take on that.
Okay, bring it.
I think it's like she's wearing that because it's gonna
accentuate.
Thank you.
100%.
I was thinking that.
Well, it's accentuating it a lot more.
And I will tell you,
it is a difference. You can tell.
I would not do the surgery, but if someone put a gun to my head, made me do one, you would have to wear that for at least a couple months. So that's that's post-op.
Oh, okay.
And I think on that video she was like a month, because where you take those ribs out, like there's going to be a space and you're going to close it up, but you want compression on there. You don't want blood filling up in there. You don't want the tissues like getting pulled on themselves. So that corset's going to put compression on those areas to basically prevent complications.
Okay.
So yeah, I mean, she did get a result from this, and if that's the look that you want, I guess it's a good one. Yeah, please, Kalee, go ahead.
I have a question.
Jump in there.
Okay, so let's say,
yes.
she's not as young as she used to be.
Right.
Okay. Let's fast forward, 10 years when our bodies go through menopause and all kinds of things as women. and she starts gaining weight.
Mm-hmm.
What does that look like for a non-rib situation?
I don't think that would have
much of
a huge influence.
So we're not going to have like a giant...
Right. Because these ribs, well, although the 10th one does give some structural...
Like a love handle up here, there's not going to be...
It shouldn't be a problem. Although the 10th rib does have some structural connections to the cartilage, these are mostly floating ribs. Like they're not like part of the structural component of your chest, which would be under more stress should you gain weight. So I don't think that's a huge problem. My biggest problems with this surgery is that if I'm going to do an elective aesthetic surgery on someone, it has to be safe. And this is just not a super safe surgery. There's a reason that these are not done in the United States. Like it's the risk to benefit tolerance is just too much. And actually on that, she herself came back and said that she regrets it. And I have a little video of that. So roll that video, that next video, Brendan.
I'm dealing with a complication right now because I've been sick for like the past week, and I coughed and I felt it pop. I think the muscles where the rib was and the muscles that surrounding it, I think it like separated again. So I just have to be like extra careful. Honestly, would not recommend this surgery to anyone. It's been really painful and also really annoying at this point. But I am starting to see results. So I'm like happy on one hand, but also like, I don't know if it was necessarily 100% worth it. So.
Yeah,
that's great that she said that though.
I agree. Like she's being honest. She's like, look, I did this. I would never recommend it to anyone. And although I like the results, I'm not sure it's worth it. And I think that's a very, very fair take. I mean, she did have some complications, nothing, life-threatening, but it was not like an easy journey for her after watching those videos. And I mean, I'm glad she's being honest about it. But yeah, I mean, that's my worry. I mean, and outside of the fact that now she's got a lifetime of, she's in a little bit more danger if she's, ever.
Can she put them back in?
No.
She has the bag.
That's a good idea. I like that you're thinking outside of the box. But yeah, I just
like to be a problem solver.
Not really sure that's gonna work. Maybe she could put them on the outside, like some armor. I don't know.
Halloween costume.
So yeah, I just am against this surgery. I mean, there's the short-term risk, there's the long-term risk. I get that it does give that kind of ant waist look, which I personally don't like that look. So
I don't either.
Yeah, I just don't like it. To me, it looks unnatural.
With respect.
Yeah, with respect, yes. It looks a little bit unnatural. Now, in the spirit of being complete, I will tell you that the United States does offer an alternative. And I am not necessarily a huge fan of this one either, but I want everyone to know. So there is a surgery called the Rib X-Car. I'm not sure where they came up with that name. But instead of taking out the ribs, what they do is they go around to the back where the ribs kind of come off the spinal column, and they actually drill a couple holes in the ribs so that point weakens, and then they infracture it. So what it does is where those ribs are, making their kind of upper torso or waist area be a little bit wider, they're breaking the ribs at the back and then bending them inward.
I don't like that.
I don't like it either, Brenda.
Does that cause a higher chance of rupturing said spleen?
Well, I would be nervous about that myself. I will tell you the ribs are not just kind of, even though they call them floating ribs, they're pretty attached to like muscles and other tissues. So, I like what you're thinking. It's like, oh, I fractured this and I've been in, is it going to poke my spleen? I mean, it's not out of the realm of possibility. I mean, that would be a concern that when you infracture it, does it puncture into your abdominal cavity and cause problems? I mean, it's not a definite that would happen for sure, but it's not a impossibility either. The American Society of Plastic Surgeons actually considers that a reasonable and safe surgery, the Rib X-Car, basically the infracturing. I did actually have a picture if somebody wants to see it here. It's that last photo. That is a Rib X-Car. That is not a rib removal. It's done through a much smaller incision because they only have to basically drill a couple holes in the rib as opposed to pull them all the way out.
I feel like the hips look wider.
They do.
Yeah, I think it's one of those situations where, the biggest force in the tree looks bigger. Yeah. I've totally just butchered that. I butchered that analogy. But you guys are like, yeah, I know what you're talking about. I mean, because her waist is so small, her hips do look bigger. Again, I'm not a huge fan of that look, but I mean, if somebody in the United States was 100% convinced that they had to go and do something like this, please do this versus having your ribs removed.
Or you could just do hip twists like every day.
You could, yeah, just build up your hips, yeah. So anyway, oh yeah, the hip twists. Yeah. You have to have weights on when you do that?
No, you just get like on your
Like
arms.
medicine ball or something.
You like lay on the
Russian
floor.
twist.
You,
Oh, Russian twist. I
yeah,
didn't know that one.
your arms are on the floor and you dip and you dip and it's a plank. And it's supposed to help with this.
With the core.
With your core and the ribs.
I used to know all those things when I was really into CrossFit, and I've since forgotten them. So, but yeah.
Well, I haven't done them lately, but.
Right. So pretty crazy stories.
Yeah, that is crazy.